Today, 12th October, is World Arthritis Day, so designated to remind us all of this crippling and potentially curable disease that has terrible impact on the life quality of so many people in the world. Now, arthritis is defined as a painful limitation of movement of any of the joints. We have 200 plus bones, and all of them are uniquely articulated or joined to each other, and they form a complex system which helps us in maintaining our posture, balance. It helps us to play, look around, run, sit. It also requires periodic rest and recuperation. When any of the joints is damaged due to any reason, the disease is called arthritis. This causes pain, swelling, inflammation, and restriction of movement of the joints. It could be one joint or multiple joints. Traditionally, the cause of arthritis could be either an infection like tuberculosis or other pus-forming organisms. It could be an inflammatory arthritis, which means rheumatoid arthritis or ankylosing spondylitis or any of the other 300 known conditions which cause an inflammatory arthritis. It could be a degenerative etiology where we have wear and tear and loss of cartilage of the joints so that the joints become inflamed. It could be related to injury, or it could be related to malignancy or growth in the system. Almost anything that damages the bone and cartilage in the joint can cause an arthritis. Most people think arthritis is something that starts off in old age. Well, that's partially true because the bulk of patients that we see with arthritis are generally older patients. But we have seen inflammatory arthritis in practically newborn children, and the spectrum of disease can range from 1 year to 90 years. Arthritis is a painful limitation of movement of the joints, so the presentation depends on which joint it affects. Say if you have a problem with the shoulder, you will have difficulty in raising the arm. If you have problem with the knee, you will have difficulty in going up and down the stairs or in squatting or sitting cross-legged. Arthritis can also involve the spine. So if you have an inflammation of the joints of the upper spine, it can cause severe pain, rigidity. Sometimes if there's a lot of pressure, a lot of inflammation, it can also cause entrapment of the spinal cord. Similarly, arthritis of the hips, knees cause both local symptoms and symptoms of entrapment of the nerves, vessels that cross that joint. The range of symptoms varies, but typically most of the time the symptoms are related to one or few joints. Many young people do develop arthritis, but this is a very specific kind of arthritis. Most of the times it's either because of an infection, which means a bacterial, viral, fungal or tubercular infection, or because of inflammatory conditions like rheumatoid arthritis. Like I mentioned earlier, rheumatoid arthritis can affect very young people also, and that is the predominant kind of arthritis that is affecting young people nowadays. With better standards of hygiene, better control of infection, better antibiotics and better healthcare available, slowly the incidence of infectious arthritis has gone down over a period of time, especially the kind of arthritis that affects young people. But the number of cases of inflammatory or autoimmune arthritis has actually gone up over a period of time. Well, potentially arthritis is a lifelong condition, but not all kinds of arthritis are either painful or symptomatic or active at all phases of the life. It depends on the cause, as I said earlier, but degenerative arthritis is generally a lifelong condition. Autoimmune arthritis can wax and wane. It can be active during certain phases of life. It can also almost completely disappear. Infectious arthritis, of course, is a one-time condition. It gets okay and that's the end of the problem. Well, arthritis is a very, very disabling condition. I mean, anybody who's even had a ankle sprain can realize that especially in the lower limbs or the upper limbs, it can affect quality of life. It affects your occupational life, your personal life. It is a very, very painful condition. and it affects almost all facets of your life, including your house, your family, your work, and your place in society, which is why it is very necessary to identify these cases. 70% of patients who walk into an average orthopedic OPD will be having complaints of pains. Not all of them have arthritis, but the ones who do have potential for severe debilitating lifelong disease, and it is very essential that we investigate anybody with joint pain, especially anything more than 3 to 4 weeks, identify it and initiate treatment. Fortunately, with advances in therapeutics and the availability of drugs which can mediate immunity, we have much better response. We can prevent long-term damage to the joints and make the life of the patient comfortable and satisfactory. I think the first part is being aware of it and identifying the problem, which we've already covered. Once the disease is identified, the precipitating cause has to be treated, whether it's an infection, whether it's immunity or whatever. Obviously, there is no cure to or no treatment of degenerative conditions, in the sense you can't reverse those changes. A lot of the changes are irreversible, and this has to be communicated to patients, and lifestyle modification, exercise, dietary modifications, drugs are the mainstay of treatment for almost 85% of cases. In the other 15% of cases where the arthritis has potential to damage or has already caused very severe damage to the joints, surgical options are also useful. Surgical options might be conservative surgery in terms of removing of inflamed parts or joint debridement or removing of damaged synovium, or it could be arthroscopic lavage. Very aggressive treatment in terms of joint replacement is generally reserved for elderly people. It is not generally prescribed for younger people. But in rare cases where you have a post-tuberculous arthritis of a 17 or 18-year-old, we can advise a joint replacement and carry it out to maintain the quality of life of the patient. The message here is that we have to identify, isolate those patients who require active treatment, monitor those who are not actively treated, and go the whole range, right from dietary modification to surgery, to make the life of the patient comfortable and bearable.